It's my pleasure to present a paper that I worked on while at Albany Medical College in New York. The principal goal of the study is to explore the previously under-examined patient population with significant psychiatric comorbidity undergoing invasive procedures. In our experience, folks with PTSD tend to bias towards avoidance as well as non-compliance when coming in for regular urological care, creating apprehension amongst providers to deal with these challenging patients. Specifically, we wanted to identify characteristics of prior trauma that may best predict anxiety as well as apprehension in these patients, as well as pain during urological testing. To do so, we conducted a prospective observational study measuring patient-reported outcomes. 60 patients were in our study total, who are scheduled for cystoscopy, UDS studies, as well as prostate biopsy. Unfortunately, only one patient was undergoing prostate biopsy, so that data was dropped from our analysis. This is the schema with which we designed our study. Two key points of measure we had was pre-procedural as well as during the procedure. In pre-procedural, we were able to collect life event checklists as well as PTSD checklists. This was conducted to stratify our patients into the three groups that you guys see here. With regards to their previous history of invasive bodily traumas, including iatrogenic as well as sexual traumas that are prevalent, dividing that from the non-invasive bodily traumas as well as our control group. We're able to assess anxiety with our rapid anxiety assessment, as well as look at pain during the procedure with the Wong-Baker faces. So what we found was a significant correlation between PTSD scale scores as with anxiety with our linear regression modeling. It corresponded with increased levels of anxiety in both pre as well as during the procedures that these patients were going under. Importantly, we found that the types of trauma did not correlate with the PTSD scale, nor did they correlate with the anxiety with the RAA score. This is not entirely surprising, as we know that the development of PTSD pathology involves a reflective as well as rumination functions in our patients, and not necessarily dictated by just the nature of the traumas that these patients are undergoing. What was surprising from our data set was that we found the pain did not correlate with levels of borderline PTSD symptomology. There's previous studies in Europe that looked at patients with comorbid depression and anxiety that showed an increase in pain perception. However, their time points of measure was vastly different from ours. They looked at it at a 2-week mark. It is not unexpected that patient reactions to the procedures evolve over time. And as far as we know, this is our very first study looking at patient perceptions of pain during. And it also presents an opportunity for us to develop interventions during this peri-traumatic period to mitigate negative experiences as well as facilitate positive emotional processing to tackle these challenges. Also important in our data, we found that when comparing the traumatic groups, the patients with a significant history of invasive bodily trauma experience higher levels of pain as well. All in summary, we found that it is important to both screen as well as record patients with a history of PTSD, specifically those with invasive bodily traumas, to provide adequate counseling as well as setting expectations for their experiences during these invasive procedures with regards to pain and anxiety. Especially with our high-risk group. But generally speaking, patient-informed and trauma-informed care for this specifically, for this patient population is incredibly important to tackle the apprehension that these patients may face when we are doing our regular care for them. Thank you so much for your time.
I think this is a very interesting study. Congratulations. I think it would be interesting to see how this what you've applied might apply to other fields that aren't. So you're talking about invasive bodily trauma. Of course, in the field of urology and gynecology, that's a particularly sensitive area. I mean, you listed on their sexual abuse in your abstract.
Absolutely.
I wonder how that would apply if you're talking about someone who's undergoing some sort of general surgery something that's not in the pelvic area that,
Right.
that would be, who would be sensitized because of some abuse. I'm not asking that very well, but I wonder how that would apply in a different field that's not urogynecological.
Absolutely. The vast majority of studies surrounding iatrogenic PTSD has to do with in the ICU setting. Again, in that particular subset of patients, the rate of developing these type of traumas, as well as the sensitization to
Right.
pain and negative experiences are quite high.
Yeah. Thank you.
Yeah, thank you.
Thank you.